Local Women Magazine presents Local Women Podcast, the show for things that matter.
Hi, my name's Emma Heaney and I'm the podcast host for the Women's Podcast for Health. And my background is women's health in gynecology, midwifery and health visiting. And today I'm delighted to be joined by Dr. Linda. And Linda is a gynae registrar in her final year of consultancy training. Isn't that right, Linda?
Yeah.
Linda also has a private women's clinic in Derry as well. So not only is she my esteemed colleague, but she's my dear friend too. So I'm delighted to have you on board today, Linda.
Thank you for having me.
You're very welcome. And today we're going to talk a lot about the big topic that Veena McCall made so popular is the menopause.
Yeah.
So would you like to explain to me what exactly is the menopause?
Well, menopause marks the period of life for women where they can no longer have a baby. So ovulation stops and it's cessation of your menstrual period. So the natural age of menopause occurs around age 51. However, women can have menopause earlier through surgical reasons. So women who've had their ovaries surgically removed, or women who've had to take medication such as chemotherapy, which then stop the function of their ovaries to produce their ovulation and their menstrual cycle.
Mm-hmm. And I know we were talking sort of off camera, and Linda made a very good point that we're going to spend 40% of our life in the menopause. So, I mean, we know that there's so many symptoms of the menopause. We know, we hear lots of things being said with regards to hot flushes, night sweats, etc. But there's a lot more to it than that, isn't it, Linda?
Yeah. So with life expectancy getting longer, women can live now, from evidence is shown in 2022 that women live up to the age of 89. So if you have menopause at age 51, then you will have 40% of your life in the postmenopausal period. It's often now referred to as midolescence. We have an adolescence when we're going through puberty, but now we're in midolescence. So during this time, women that do have menopause, which is the end of period, often for about 6 to 13 years prior to that, they have a perimenopausal period where they have times where their hormones are very erratic. So when you're young and in your younger years, your hormones are quite balanced each month. So you have peaks and troughs of estrogen and progesterone. However, during the perimenopause, you can have peaks and troughs on a daily basis of your estrogen and progesterone. And with that can come like an array of symptoms, as you've said. There is hair loss, hair thinning, skin thinning, atrophy of which is thinning of the skin in the vagina. You can have painful intercourse, you can have frequency, you can have urinary tract infections, brain fog, lack of concentration, low libido. Sometimes women often feel very anxious because they don't realise what's happening. And they can have like musculoskeletal things as well, so sore joints, sore muscles. Just it affects every body system.
Mm-hmm. I was at a conference recently and they talked about the 34 symptoms of the menopause. Yeah. And as they listed them, obviously I'm a lady of a certain age, I was going, I could tick the box with a few of them. But it's quite interesting because then obviously I was doing a little bit of reading before our interview today. And then another site said about 42 symptoms. So there's so many out there, isn't there? But you touched on a really valid point there where you said about the sensation of the period. But I think this is what a lot of my clients speak to me all the time about. Oh, I'm menopausal, but you're actually not menopausal unless you've had 12 consecutive months with no period. Yeah. And I think that's really important.
Yeah, so for diagnosis, just to allude back to the surgical and medical menopause, those are things that we as doctors cause menopause, and then you have your natural menopause, which is around age 51. But there is a small proportion of women that have a premature ovarian insufficiency, and those women have about 1% of women that will happen to before the age of 40, and about 0.1% will happen before the age of 30. And it's very important that those women have their hormones replaced until the natural age of menopause. And the reason being is that your estrogen and progesterone don't only help making babies and maintaining pregnancies, but they also protect your bones and protect your heart. So you're more likely to have osteoporosis or a cardiovascular disease after menopause. So if you have had menopause too early, then we need to protect those bones and your heart right up until the age of natural menopause. So as you said, menopause is the cessation, so it marks the end of your baby making years. So in the 6 to 13 years preceding that, when the hormones are erratic and they're up and down, you can have all those array of symptoms, and that is called perimenopausal. So what the women are experiencing is perimenopause, but they're often not diagnosed with it because they don't know how, and women often seek help from their GP, which they rightly should. Anybody who's having any symptoms, any change in periods, should always go and seek help with their GP, because if they have any complex medical or past medical history, they must be referred on to a menopause specialist. So it's really important that you do seek the medical help. But in those years, when they're perimenopausal, if you want diagnosed, if you are over the age of 45 and having these symptoms, you are perimenopausal. You do not need a blood test. And that's a really important thing, because I often hear patients tell me, can I have a blood test, or how do I get a blood test? But they don't need one if you're over the age of 45.
And you're experiencing these symptoms.
And you're experiencing
That's really good to know.
So anybody under the age of 45, so in the period between 40 and 45, you can do a blood test called follicle stimulating hormone.
Yeah.
And that is a hormone that's secreted from your brain. It's a little message from your brain that goes to your ovaries to tell your ovaries to work. And it's pumping it out lots. It's pumping out lots of it. And that's where you get the hot flushes and the insomnia, because it's the follicle stimulating hormone. The levels are so high. So for you to be diagnosed as perimenopausal or menopausal between 40 and 45, we would recommend that you undergo 2 blood tests of your follicle stimulating hormone 4 to 6 weeks apart.
Right, that's really good to know. Probably a question I get asked a lot as well is contraception during the menopause or when I'm perimenopausal. Should they take contraception?
Yes, absolutely. So contraception, all these symptoms you have of menopause are also symptoms of pregnancy.
Yes.
So if you're having flushes or irritability, tiredness, they could be symptoms of pregnancy. So you can still get pregnant up to the age of 55. So menopause or perimenopause and taking HRT won't protect you from pregnancy.
So you also need contraception as well, ladies.
Yeah. So over the age of 50, the chances of you becoming pregnant are slim, but it has happened, and I've seen it happen before. Okay.
I wanted to ask you as well, right? So you can have the blood test, which is brilliant. And I think anybody that's listening here, what is the gold standard, for the management of the menopausal lady?
So if you are seeking hormone replacement therapy or seeking alleviation of your symptoms, then taking HRT would be what you would use in the first instance. And women who have a uterus or still have their womb would need to replace both estrogen and progesterone, because estrogen is the hormone that makes us feel good, but it also thickens the lining of the womb. And the progesterone then keeps that lining from overgrowing. So it's really important that you're taking both your estrogen and your progesterone. So women who don't have a uterus or their womb has been removed for surgical reasons, then they only need estrogen. So the estrogen can be taken orally through a tablet or transdermally through the skin.
And what about a lady that doesn't have a uterus, but the progesterone's very good for like the natural antidepressant, it makes them feel good. What's your thoughts on that?
It actually doesn't.
You don't think so?
I don't think so. So it's actually the estrogen that makes you feel good. So progesterone is the hormone that you get in the luteal phase of your menstrual cycle. So that is the hormone that you get leading up to your period when you're bloated and you're irritable and you're tearful. So it's there to maintain the pregnancy. So that's why women who often have things like PMDD. So that's
just explain to everybody else. We know what it is. But
so that's your premenstrual disorders. That's why they often feel better once they start menstruating, because the progesterone level drops. And some women can't take progesterone-only pills, and some women can't take Mirena coils because they're very sensitive to it. So if you want to feel good, it's your estrogen that makes you feel good. The progesterone is only there as a protective.
Just for the lining.
Just for the lining.
That's good to know.
So, estrogen is the one. Estrogen's your friend.
Okay. So estrogen being my friend, where does testosterone sit on this?
So testosterone helps with libido. So some women, despite being on HRT, still feel a bit lackluster in the bedroom. So they don't have the same libido they had as when they were younger. So testosterone is very good for helping low libido. The only thing with it is that it's a male hormone and it shouldn't be used in excess. So you need to seek help from a specialist, like a menopause specialist, or a gynecologist, or your GP. So seek medical advice on the dosage, because you can often have irreversible side effects.
Yeah, and some of the side effects are hair loss, isn't that right? Deep throat.
Yeah, deep voice, hair loss on the head, but hair growth.
Everywhere else.
Everywhere else.
And you can't actually just get that from your GP. You do need to go to a specialist. I think we need to sort of make that very, very clear.
Yeah, so your GP can manage your HRT and adjust it, but if there was anything more complex, it's really important that you go speak to a menopause specialist.
So say for those ladies that don't want to go on a HRT, what is their options?
So there are non-hormonal things, or alternative therapies, black cohosh, evening primrose, and then there are your bioidentical type of hormones. The British Menopause Society feels that there may be not enough evidence around bioidentical hormones, but there are two main types. There's your regulated ones and your compound, and there is a small piece of evidence that suggests that the regulated ones are the better type of bioidentical hormones.
And what about for those ladies that aren't sleeping and they're feeling low mood and they're not suitable for hormonal replacement therapy? What's your thoughts there? What would be your treatment plan for that lady?
So I would recommend that you see your GP. So personally, I wouldn't give a treatment plan because I'm not a menopause specialist. However, I am a gynecologist, and I do know that anyone with low mood should always seek the advice of their GP. So they might need a mild low-dose antidepressant to help get through the anxiety or depression that they're experiencing, secondary to their lack of hormones.
So, Linda, what do you think about supplement in the menopause? There's so much information out there. We talk about ashwagandha, we talk about magnesium, and for our listeners, they don't really know. Everybody's recommending something different. So I just want to know your thoughts on supplementary therapy.
So you have to be very careful about supplements, because supplements, you need to find where the information that where you're getting this information from.
There's a lot on TikTok. There's a lot on social media.
So you have to just be careful about the source of information. Is there evidence behind it? Who is posting it? Do they have alternative motives? Are they trying to sell supplements? It's really important that you always seek medical advice, is what I would advise. So if you have any questions regarding magnesium or ashwagandha. Or even in primrose oil, go speak to your GP. And I know it's difficult at times to get access to GP, but there are menopause specialists that you could go and see, and they would advise you, because they are trained in these types of supplements, and they understand that women are getting multiple sources of information. But things that I would personally recommend would be things like zinc, magnesium, vitamin D. Yeah, they're all good.
Good research. Good research behind them.
Those,
yeah. And for yours, why would you recommend them to take zinc? Just we know. But
So zinc is a natural boost of testosterone. So women who maybe are feeling like their testosterone is low, they could try alternative natural ways to boost it. So get a good sleep, use vitamin D, use zinc, weight-bearing exercise. So lifting weights is very good. Cutting out alcohol and trying to get proper sleep. There are all ways to boost your testosterone.
I bet the zinc sales now go skyrocketing. When we talked about resistance training, I mean, that's really good because we lose muscle mass in the menopause, isn't that right? And we want to do more resistance training as opposed to cardio, isn't that correct?
Yeah, so resistance training is very important because it also increases your bone density. So with the drop in your estrogen levels and progesterone, then your bone mineral density goes down. So you're a higher chance of getting osteoporosis or osteopenia. So resistance exercise would be much better overall because it reduces your frailty, it builds your muscle mass, and it increases your bone density.
So with regards to magnesium, Linda and I had a conversation, and I would recommend magnesium because it really does help with the sleep. There's some fantastic papers written on that. And if I know a lot of people don't really want to go down maybe the medicated route just yet, these are things that you can do from a self-help point of view.
Yeah.
You know?
So I don't know much about it. I know that it helps with sleep and muscle cramps. And a lot of women that I would see in my own clinic would be taking it, and they swear by it.
I'm a big fan personally. When you say your own clinic, so what services do you offer from a health perspective in your private clinic in Derry?
So we offer blood tests and ultrasound scanning, and we will have a menopause specialist joining our team in January. So we want to specialise in women's health because we feel like in Derry, it's, you know, Emma, it's very limited where people can go.
Yes.
So we will have 3 gynae sonographers that will work from the practice, and there will be blood tests, things like endo tests, harmony tests for people that are pregnant, but we won't be doing any pregnancy scanning as such. It's more women's health and gynecological issues.
Okay. So we often get asked about ladies that have frequency at night time going to the toilet quite a lot. What's your advice or treatment plan for that patient?
So during the menopause, with the drop in the hormones, women often undergo urogenital symptoms. So that is things like urgency, frequency of passing urine, nocturia, which is getting up in the middle of the night to pass urine, and painful intercourse. And it's all related to the lack of hormone and a thinning of the skin in and around the vagina. So sometimes the urethra, which is a small opening to pass urine, can become cracked and you can have frequent urinary tract infections. So if someone didn't want to take any systemic hormone replacement therapy, they could take something very localized, and it would be either a gel or a pessary in the vagina of local estrogen, which would really minimize those symptoms. If they didn't want to have anything hormonal, we would recommend something non-hormonal, even just an emollient would help as well.
I think it's really good to know that there's more there than just HRT, but there's support out there as well, which
Lots
I think
of support,
you had a talk recently. Somebody came into the clinic, isn't it? Neve, wasn't it?
So Dr. Neve Doherty is a gynecologist, and she had come to the clinic to offer a free workshop for women just to educate them in menopause, symptoms of menopause, treatments in and around menopause. So she talked a lot about alternative therapies and hormone replacement therapy and intercourse during the menopause, because it changes, things change. And we are going to offer free workshops for women in the future. They're only about 2 hours long, and they're free to come along, cup of tea, and have a chat to a gynecologist, because I do know that women's health has suffered. So as women, since COVID, I feel like the women aren't being seen as often, or the waiting lists have gotten a bit longer.
I think that's amazing that you're offering that, because I'm getting asked so many questions, and I think it's so important that, you know, like we talked about, where to get your information from the right sources.
Right sources. Yeah.
And I am dispelling so many myths in the clinic when they're asking me a question, I'm thinking, no, that's not correct.
Yeah.
So this is really good. Please let us know when you're having your next workshop, and I'll share it on my social media as well.
Brilliant. Thank you, Emma.
You're very welcome. Thank you so much for coming in, Linda. We have really enjoyed. I mean, we could talk menopause for hours, but I hope you've enjoyed it. Thanks, Linda.
Thank you, Emma.
Local Women Magazine presents Local Women Podcast, the show for things that matter.